Discovery of Alzheimer's disease pre 20th century understandings. Before the formal recognition of Alzheimer's disease, various forms of dementia had been documented throughout medical literature. Many physicians and researchers had described symptoms resembling what we now classify as dementia, but the understanding of these conditions was limited. The terminology was often vague, and conditions such as senility were frequently lumped together without a clear differentiation. Many people, especially in older age, exhibited cognitive decline, which was broadly misunderstood as a normal part of aging. As society began to age, the medical community started to pay more attention to cognitive impairments, yet the nuances remained obscure. Emile Kraepelin, 1856 to 1926, the foundation for a clearer understanding of different types of dementia was significantly advanced by Emile Kraepelin, a prominent German psychiatrist. Kraepelin's work laid the groundwork for modern psychiatry, and he introduced a systematic approach to the classification of mental disorders. In his influential textbooks, he categorized dementia into various forms, effectively distinguishing between what he termed senile dementia, which affected the elderly, and presenile dementia, which occurred in younger patients, often in their 40s or 50s. He noted that presenile dementia had distinct clinical features, a more rapid progression, and a generally poorer prognosis. Kraepelin's work became pivotal, as it highlighted the need for a more nuanced understanding of cognitive decline and laid the groundwork for future research into the causes and treatments of dementia. Alois Alzheimer, 1864 to 1915, the most critical breakthrough in the recognition of what would later be known as Alzheimer's disease came with the pioneering work of Alois Alzheimer, a German psychiatrist and neurologist. In 1901, Alzheimer began treating a patient named Auguste Deter, who was only 51 years old at the time. Deter exhibited severe memory loss, confusion about her surroundings, and personality changes that were striking and alarming. Alzheimer meticulously documented Deter's symptoms over the years, observing her cognitive decline, and following her death in 1906, he conducted a thorough autopsy. His findings revealed abnormal structures in her brain that had never been documented before. Alzheimer described these structures in detail, including neurofibrillary tangles, twisted fibers that accumulate inside nerve cells, leading to cell dysfunction and death, senile plaques, amyloid plaques, deposits of beta-amyloid protein that form outside neurons, disrupting communication between brain cells. Alzheimer's careful observations and his detailed clinical notes set the stage for future research and paved the way for a greater understanding of the disease. His work was groundbreaking, as it connected specific symptoms with observable pathological changes in the brain. Naming the disease. In 1910, Emile Kraepelin, recognizing Alzheimer's significant contributions to the field, named the condition Alzheimer's disease, Alois Alzheimer's disease, in his influential textbook on psychiatry. This formal recognition marked the first time a specific condition was identified with a distinct pathology and set of symptoms. The naming of the disease after Alzheimer not only honored his work, but also helped to legitimize the condition as a serious medical concern, warranting further research and understanding. This act of naming also provided a focal point for future investigations into the biological underpinnings of the disease and highlighted the importance of scientific inquiry in understanding mental health conditions. Advances in research and understanding 20th century developments. Throughout the early to mid-20th century, research on Alzheimer's disease continued to evolve. However, it remained relatively obscure compared to other medical fields, often overshadowed by more prominent diseases like Parkinson's and multiple sclerosis. Many studies during this period focused on its clinical features and post-mortem findings. The rise of neuroanatomy as a discipline allowed researchers to begin to visualize changes in the brains of patients who had died from dementia, but the understanding of Alzheimer's remained limited. As a global population aged in the latter half of the century, the incidence of dementia, particularly Alzheimer's, became increasingly prevalent. This demographic shift prompted greater awareness and the need for research to address the challenges posed by an aging society. Pathophysiological discoveries. The 1970s and 1980s saw significant advances in understanding the biology of Alzheimer's disease. Researchers began to identify genetic links and the biochemical processes involved in the formation of plaques and tangles were elucidated. Key studies during this time suggested a connection between the accumulation of beta-amyloid proteins and neuronal death. Notably, the discovery of mutations in the amyloid precursor protein, AP, gene on chromosome 21 in the early 1990s provided important insights into familial Alzheimer's disease, which tends to occur in younger individuals and is often hereditary. This discovery emphasized the role of genetics in the disease's pathology, opening new avenues for research into targeted therapies. Diagnostic criteria and recognition. In the late 20th century, the development of diagnostic criteria for Alzheimer's disease was a significant milestone. The release of the DSM-3 in 1980 and subsequent revisions helped establish standardized ways to diagnose and research the condition. The National Institute on Aging and the Alzheimer's Association released comprehensive guidelines for diagnosing Alzheimer's, aiding clinicians in distinguishing it from other forms of dementia, such as vascular dementia and frontotemporal dementia. These criteria emphasized the importance of a thorough clinical assessment, neuropsychological testing, and the observation of cognitive decline over time. The increased focus on standardization improved the consistency of diagnoses and enabled researchers to conduct more rigorous studies, ultimately leading to a better understanding of the disease's progression and variability among patients. Modern perspectives and future directions. Current understanding. Today, Alzheimer's disease is recognized as a multifaceted disorder with genetic, environmental, and lifestyle factors contributing to its development. It is characterized by a progressive decline in cognitive functions, impacting daily living and quality of life. Ongoing research is focused on understanding the underlying mechanisms of the disease, developing biomarkers for early diagnosis, and finding effective treatments to slow or halt disease progression. Research efforts have also highlighted the role of inflammation, vascular health, and metabolic factors in the development of Alzheimer's, suggesting that a multifaceted approach to prevention and treatment may be most effective. Public awareness and advocacy. Over the years, awareness and advocacy for Alzheimer's disease have increased, leading to greater funding for research, support for patients and caregivers, and a push for more comprehensive healthcare policies to address the needs of those affected by the disease. Organizations such as the Alzheimer's Association have played a crucial role in raising awareness, funding research initiatives, and providing resources for families impacted by the disease. Public campaigns and educational programs have helped demystify the condition, fostering greater understanding among the general public and promoting a more compassionate approach to caregiving and support. The discovery of Alzheimer's disease is a remarkable journey through the history of medicine, evolving from vague observations of cognitive decline to a well-defined condition with a recognized biological basis. It exemplifies the importance of meticulous clinical observation, research, and collaboration across disciplines in advancing our understanding of complex diseases. As research continues, there is hope for better diagnostic methods, effective treatments, and ultimately, a cure for Alzheimer's disease. Ongoing investigations into novel therapeutic approaches, including immunotherapies targeting amyloid and tau proteins, lifestyle interventions aimed at reducing risk factors, and advances in neuroimaging techniques, are paving the way for breakthroughs that could transform the landscape of Alzheimer's treatment and management. In summary, the journey of understanding Alzheimer's disease reflects a broader narrative about the evolution of medical knowledge, highlighting the interplay between clinical observation, scientific inquiry, and societal engagement in addressing one of the most pressing health challenges of our time. The commitment to research and advocacy continues to inspire hope for the millions affected by this disease and their families. Prevention and treatment of dementia and Alzheimer's disease. Defining dementia is an umbrella term encompassing various cognitive disorders that affect memory, thinking, and social abilities severely enough to interfere with daily functioning. Alzheimer's disease, the most common type of dementia, is characterized by specific neurodegenerative processes. It is crucial to differentiate dementia from normal age-related cognitive decline to understand its seriousness. The World Health Organization (WHO) estimates that nearly 50 million people worldwide are living with dementia, a number expected to rise significantly. The term dementia has been used for centuries, but our understanding has evolved dramatically. In the late 19th and early 20th centuries, Alois Alzheimer first identified the disease that bears his name. Since then, various researchers have contributed to our understanding of Alzheimer's pathology, including the discovery of amyloid plaques and tau tangles. Early diagnostic criteria and the development of imaging techniques have transformed how we identify and study dementia. Landmark studies in the late 20th century paved the way for modern therapeutic approaches. Types of dementia beyond Alzheimer's. Dementia includes vascular dementia, Lewy body dementia, frontotemporal dementia, and mixed dementia. Each type presents unique challenges in diagnosis and treatment, requiring tailored approaches. Vascular dementia often follows strokes or other vascular events, impacting cognition differently than Alzheimer's. Lewy body dementia may involve visual hallucinations and fluctuating cognition. Understanding these distinctions is essential for effective care and support strategies. Alzheimer's is primarily marked by the accumulation of amyloid beta peptides and hyperphosphorylated tau proteins in the brain. These proteins disrupt neuronal communication and lead to cell death over time. Neuroinflammation plays a significant role in the progression of Alzheimer's, often exacerbating symptoms. Genetic factors, particularly the ApoE4 allele, are linked to increased risk, but environmental factors also contribute. Ongoing research seeks to unravel the complex interactions between these biological mechanisms. The prevalence of dementia is on the rise, particularly among older adults, leading to a growing public health crisis. Factors such as increasing life expectancy and aging populations contribute to this trend. Gender differences exist, with women being disproportionately affected due to longer lifespans. The economic burden of dementia care is staggering, affecting healthcare systems worldwide and prompting urgent calls for more research and funding. Impact on families and society. The emotional and financial impact of dementia on families can be profound, often resulting in caregiver stress and burnout. Stigma surrounding dementia can lead to isolation for both patients and caregivers, complicating their experiences. Support systems, including community resources and educational programs, are vital in assisting families navigating this journey. Policymakers are increasingly recognizing the need for comprehensive care strategies and funding for research. This section will be divided into multiple subsections, covering a wide range of topics related to the prevention and treatment of dementia and Alzheimer's disease. Early symptoms. Early signs of dementia may be subtle and often mistaken for normal aging, including minor forgetfulness or difficulty finding words. Memory loss that disrupts daily life is a common early warning sign. Difficulty performing familiar tasks, such as managing finances or following recipes, can also indicate cognitive decline. Mood changes, such as increased anxiety, depression, or withdrawal from social activities, may accompany early cognitive changes. As dementia progresses, confusion becomes more pronounced, leading to disorientation regarding time and place. Individuals may struggle to recognize familiar faces or places, causing distress for both patients and caregivers. Behavioral changes, including agitation or aggression, may manifest, complicating caregiving efforts. Language skills decline, leading to challenges in communication and expression. Advanced symptoms in the later stages of dementia. Individuals may lose the ability to carry on conversations or respond to their environment. Severe memory loss can lead to an inability to recognize loved ones or remember personal history. Physical health may decline, leading to difficulties with mobility and personal care. Care needs increase dramatically as individuals require assistance with daily activities. Preventive measures for dementia: physical exercise. Regular physical activity is associated with a lower risk of cognitive decline and dementia. Aerobic exercises, such as walking, swimming, and cycling, promote cardiovascular health and brain function. Strength training and balance exercises can reduce fall risk and improve overall physical health. Group exercise programs foster social engagement, which is crucial for cognitive health. Mental stimulation: engaging in mentally stimulating activities, such as puzzles, games, and learning new skills, can strengthen cognitive reserve. Lifelong learning and education contribute to cognitive resilience, helping individuals cope with brain aging. Activities like reading, writing, and participating in discussions stimulate brain activity and may delay onset. Technology-based cognitive training programs show promise in enhancing cognitive function among older adults. Social engagement: social connections play a vital role in cognitive health, with studies linking social interaction to reduced dementia risk. Participating in community activities and volunteer work can enhance social engagement. Family support and maintaining friendships are essential for mental well-being and cognitive function. Interventions that promote social interaction can lead to improved outcomes for those at risk. Dietary measures: a balanced diet, particularly the Mediterranean diet, has been linked to reduced dementia risk. Foods rich in antioxidants, such as fruits and vegetables, combat oxidative stress in the brain. Omega-3 fatty acids found in fatty fish, walnuts, and flax seeds are associated with improved brain health. Hydration is critical for maintaining cognitive function, with dehydration linked to confusion and cognitive decline. Sleep and mental health: quality sleep is essential for brain health, with sleep disturbances linked to cognitive decline. Sleep helps clear toxins from the brain, including beta amyloid, which accumulates in Alzheimer's. Stress management techniques, including mindfulness and meditation, contribute to mental well-being and may reduce dementia risk. Addressing mental health issues, such as depression and anxiety, is vital for cognitive health. Dietary factors in dementia prevention: foods that may increase risk. Diets high in refined sugars and processed foods are linked to increased inflammation and cognitive decline. Consuming large amounts of saturated fats, especially from animal sources, may negatively impact brain health. High sodium intake is associated with hypertension, a risk factor for dementia. Lifestyle choices, such as excessive alcohol consumption, can damage brain cells and increase risk. Foods that may help prevent dementia: leafy greens, such as spinach and kale, are rich in nutrients that support cognitive health. Berries are packed with antioxidants and have been shown to improve memory function. Whole grains provide essential nutrients and help regulate blood sugar levels, supporting brain health. Nuts and seeds offer healthy fats and vitamins that protect neurons from damage. Physiotherapy and cognitive rehabilitation: physiotherapy incorporates exercises that improve strength, balance, and mobility, crucial for older adults. Regular physical activity is shown to enhance blood flow to the brain, supporting cognitive function. Tailored exercise programs can accommodate individual capabilities, ensuring safety and effectiveness. Physiotherapists can help design home exercise regimens that encourage independence. Cognitive engagement: sensory stimulation through physiotherapy can help patients engage with their environment and evoke memories. Group therapy sessions foster social interaction and cognitive engagement among participants. Techniques such as music therapy and art therapy can promote emotional well-being and cognitive function. Mindfulness and relaxation techniques taught by physiotherapists can reduce anxiety and improve mental clarity. Mood and behavioral management: physical activity has been shown to alleviate symptoms of depression and anxiety in dementia patients. Techniques for managing challenging behaviors, such as agitation, are essential components of care. family education, and involvement in therapy can enhance the effectiveness of treatment plans. Continuous assessment of patient progress ensures that therapy remains relevant and beneficial. Emerging treatments and future research is focusing on developing medications that target the underlying pathology of Alzheimer's, including amyloid-targeting therapies. Clinical trials are investigating the efficacy of new drugs aimed at reducing tau protein accumulation. Combination therapies may prove more effective than single-drug approaches in treating dementia. Understanding the role of inflammation in dementia may lead to new anti-inflammatory treatments. Gene therapy and biomarkers advancements in gene therapy may hold promise for altering the course of Alzheimer's disease. Biomarker research is critical for early diagnosis and monitoring disease progression. Identifying genetic risk factors can lead to targeted prevention strategies. Innovative imaging techniques are being developed to visualize changes in the brain associated with dementia. Holistic approaches integrating holistic therapies, such as acupuncture and herbal medicine, is gaining attention in dementia care. Mind-body interventions, including yoga and tai chi, can enhance physical and mental well-being. Personalized care plans that consider individual preferences and lifestyles are crucial for improving quality of life. Ongoing research is essential for evaluating the effectiveness of these alternative therapies. The rising prevalence of dementia and Alzheimer's disease poses significant challenges for individuals, families, and healthcare systems. Understanding the signs and symptoms of dementia is crucial for early intervention and treatment. Preventive measures, including physical exercise, mental stimulation, and dietary modifications, can help mitigate risks. Emerging research continues to shed light on the complexities of dementia, offering hope for future treatments. A multifaceted approach, integrating pharmacological, psychological, and lifestyle interventions, is essential for effective management. Continued research into the pathophysiology of dementia will enhance our understanding of the disease and improve treatment outcomes. The development of novel therapeutic agents targeting specific mechanisms of Alzheimer's could revolutionize care. Community-based interventions that promote awareness and support for individuals with dementia are essential for reducing stigma. Collaboration between researchers, healthcare professionals, and policymakers is vital for advancing dementia care. A commitment to funding and resources is necessary to sustain research efforts and improve quality of life for those affected. Dementia and Alzheimer's disease are complex conditions that require ongoing attention and action from society. By prioritizing prevention and early intervention, we can improve outcomes for individuals and families facing dementia. A holistic understanding of the disease, incorporating biological, psychological, and social factors, will lead to better care strategies. It is our collective responsibility to support research and advocate for those impacted by these conditions. Through education, awareness, and compassion, we can create a more supportive environment for individuals living with dementia and their caregivers.